I'm Dr. Dona Cooper-Dockery, board-certified internal medicine physician, and I have had the privilege of practicing medicine here in the Rio Grande Valley for over 30 years. 30 years of sitting across from patients, listening to their stories, looking at their labs, and fighting alongside them for their health. And this is my way of bringing that same conversation to you, wherever you are, whether you're driving to work or washing dishes or sitting in your backyard with a cup of something good. I want you to feel like you're sitting right across from your doctor, because you are. Today we are talking about a number your doctor has probably mentioned, maybe more than once, a number that a lot of people hear and then quietly set aside because nobody sat down and took the time to explain what it actually means. That number is your A1C. And by the time we are done today, you are going to know exactly what it measures, what those ranges really mean, and most importantly, why the word borderline is not the good news it sounds like. I'm also going to share something with you today that I think is going to stay with you. A real story, a real patient, real numbers, because data is powerful. But people are what make it matter. Stay with me. Let's get into it. Let's start simple. The A1C test, also called hemoglobin A1C or HbA1c, is a blood test. And what it measures is your average blood sugar level over the past 2 to 3 months. Not just this morning, not just right after lunch, your average over a full 2 to 3 month window of time. Now, here's how I want you to picture it. Your red blood cells carry a protein called hemoglobin, and glucose, sugar, likes to attach itself to that hemoglobin. The more sugar that is floating around in your bloodstream, the more of it sticks. The A1C test measures what percentage of your hemoglobin has sugar attached to it. That's all it is, a percentage. So when your doctor says your A1C is 7%, that means 7% of your hemoglobin has glucose stuck to it. And since red blood cells live for about 2 to 3 months, that percentage reflects your blood sugar trend over that entire window of time. You cannot eat well for 3 days before your appointment and fool this test. Your body keeps its own record. It keeps a record whether you're paying attention or not. Now, I want you to hear the other side of that, because that same truth that the A1C reflects 3 months of choices also means that 3 months of intentional, consistent choices will absolutely show up in that number in the right direction. We'll come back to that. Now let's talk about what the numbers mean, because this is where language matters and where a lot of people get confused or misled. Below 5.7%, that is your normal range. Your blood sugar regulation is working the way it was designed to. The insulin key is opening the door. The system is functioning. 5.7 to 6.4%. That is prediabetes. And I want to stop here and sit here for a moment, because this is the range that gets brushed past far too often in a busy clinical visit. Prediabetes sounds like the middle ground, like you're not really sick yet, like you have time, like you can breathe easy because you haven't crossed the line. I need you to understand something. Prediabetes is not a hall pass. It is not a gray area. It is a warning, a loud, a clear, clinical warning that your body's ability to regulate blood sugar is already under strain. And the research tells us that without intentional intervention, a significant portion of people with prediabetes will progress to type 2 diabetes within 5 to 10 years. 6.5% and above. That is a type 2 diabetes diagnosis. Now, I want to hold all three of those ranges in front of you at the same time. And I want you to notice something. The difference between 5.7 and 6.5 is not the difference between healthy and sick. It is a difference in degree on the same continuum. The disease process that produces diabetes does not start at the diagnosis. It starts earlier. But here is the other side. And this is what I want you to carry with you. Prediabetes is the most reversible stage. With the right lifestyle changes, with the right support, with the right food and the right plan, many people can bring their A1C back into the normal range. Not just manage it, reverse it. I have seen it happen in my own practice, with my own patients, over and over again. Now, I want to teach you something that does not get nearly enough attention during a routine doctor's visit. And it matters, especially for people in that prediabetes range, or anyone who feels like their numbers should be worse than they look. It's called a postprandial blood sugar spike. Postprandial just means after eating. And here is what happens in some people. After a meal, especially a starchy or sugary one, blood sugar can shoot up dramatically, way up, to levels that, if we measured them, would raise serious concern. But then it comes back down before the next fasting test, before the next appointment. So the fasting number looks okay. The A1C looks borderline. But inside, the body is spiking and crashing over and over every single day. And that cycle is doing real damage. It drives inflammation. It drives fatigue, that heavy, foggy exhaustion some of you feel in the afternoons. It drives cravings for something sweet because your blood sugar just crashed and your body is signaling for fuel. And over time, it wears down your body's ability to regulate blood sugar at all. This is why I look at the whole picture with my patients. Not just the fasting number, not just the A1C in isolation, but everything together, the labs, the symptoms, the lifestyle, the history. Numbers tell part of the story. The patient tells the rest. You know, one of the most powerful things you can do for your blood sugar has nothing to do with a prescription. It has everything to do with your plate. The foods you eat directly affect how high your blood sugar spikes after every single meal. That's the whole philosophy behind Food Med, our planned forward restaurant right here in the Rio Grande Valley, where food really is medicine. Every dish is built with blood sugar balance in mind. Whole foods, real ingredients, flavor that does not compromise your health. And now, Food Med ships meal prep nationwide, so wherever you are in this country, you can eat like your health depends on it, because it does. Visit foodamed.com to see the menu and place your order. In over 30 years of practice, I have watched people hear the word borderline and exhale with relief because the number wasn't 6.5. They didn't cross the line, and they walked out of that office without a plan, without a warning, without anything to hold on to. And I understand that. I really do. When you're sitting in a doctor's office, you want good news. You want to leave feeling okay. I understand that completely. But I would not be doing my job. I would not be serving you if I let that word pass without telling you the truth. Borderline is not fine. Borderline means the disease process has already begun. The body is already under strain, and the difference between a 6.3 and a 6.5 is not the difference between sick and healthy. It is a matter of degree on the same road. Now, I say that not to frighten you. So let's talk about what actually moves this number, because it can be moved. I have watched it happen. There are 5 lifestyle factors that research consistently shows can lower A1C and improve insulin sensitivity. And every single one of these is something you can begin this week, not next month, not after the holidays. This week, number 1, food quality, not a diet, not a point system, not a list of foods you're not allowed to eat. Food quality. When you reduce processed carbohydrates, reduce added sugar, and increase fiber-rich whole foods, vegetables, legumes, whole grains, healthy fats, you reduce the glucose load that hits your bloodstream at every meal. Every meal is an opportunity to either spike your blood sugar or stabilize it. That choice belongs to you. Number 2, movement. Exercise is one of the most effective blood sugar tools we have. And I am not talking about running a marathon. A brisk 20 to 30 minute walk after meals specifically has been shown in the research to significantly blunt those postprandial spikes we just talked about. Why? Because your muscles use glucose as fuel. When you move, you are literally pulling sugar out of your bloodstream. That is medicine, free medicine, with no copay. Number 3, sleep. I know, we always talk about sleep, but here is why it matters for blood sugar specifically. When you're sleep deprived, your cortisol goes up. Cortisol is your stress hormone, and one of its functions is to raise blood sugar. So poor sleep directly impairs glucose regulation. 7 to 8 hours of quality sleep is not a luxury. For someone with prediabetes or diabetes, it is part of the treatment plan. Number 4, stress management. Same cortisol pathway. Chronic stress keeps cortisol elevated, which keep blood sugar elevated. Prayer, community, intentional rest, deep breathing, faith practice. These are not soft suggestions. They are physiologically relevant interventions. I have watched patients' blood sugar improve when they address the chronic stress in their lives. The body and the spirit are not separate systems. And number 5, consistency. This is the one people underestimate most. 1 good week will not move your A1C, but 3 consistent months will. Remember, this test is a 3-month average. Every choice you make today is literally writing your next lab result. Every day is a vote. Now I want to tell you about someone I had the privilege of working with. His name is Jose, and he has given his permission for me to share his story because he wants people to know what is possible. Jose came to me carrying more than 300 pounds on his body. He had type 2 diabetes, a fatty liver, and severe sleep apnea, the kind where you stop breathing in your sleep and you wake up gasping night after night after night. 3 separate doctors had told him he was not a surgical candidate, not because the surgery didn't exist, but because his fatty, enlarged liver made the procedure too dangerous. 3 doctors, 3 times. No, he came to my office, desperate. We started him on Foodamed's plant-based food meal prep, real food, designed for healing. And I want you to hear what happened next. In Jose's own words, within weeks, I felt energy, and I finally slept and without gasping. In 2 months, my A1C dropped from 12.6 to 10.2. A few months later, it reached 4.7, and my liver enzymes normalized so much that I no longer qualified for a fatty liver trial. My weight fell from 287 to 260 and kept dropping. My doctor discontinued metformin and Trulicity. Today, I only take 1 blood pressure medication. I'm not paid to say this. Plant-based nutrition and Dr. Cooper's guidance truly saved my life. The MyBestHealthPal app was built to be that tool between your doctor visits. Track your health metrics, understand your numbers, access coaching support when you need a real person in your corner. It is the kind of daily accountability that turns awareness into action. Visit MyBestHealthPal.com and download the app today.